What's going on, guys? Dr. Greg here with Movement Driven Performance Physiotherapy. Today we're going to go over a simple exercise that I like to give people to get the quad to activate a little bit better, especially in a weight-bearing stance. This is something that I really like to give to my post-op patients that are just kind of learning to walk again, or if you have a knee injury that's making you limp, making you walk a little bit weird, and compensate. This is a good way to retrain the quad muscle to fire at the right time during your gait pattern so that you can walk a little bit more smoothly. So what we're gonna do is use a power band, and I'll walk you through it right now. I got the power band just below the crease of my knee at the top of my quad. And the leg that I'm working, I'm trying to fire this right quad here. I wanna kind of stagger my stance to start with, so my right leg's a little bit behind my left one. Back up so there's a good amount of tension. Essentially what you're going to do here is I'm going to start with my weight on that front leg, so right now my left leg, and I'm on the toe of this right leg. And as I bring my heel back, I'm trying to facilitate that motion by squeezing the quad muscle and doing a quad set. So I'm squeezing back, and as I do that, I'm loading my hips back onto that right foot. So now my body weight is kind of centered over that side as opposed to being on the left. So I'm leaning back and shifting my weight over. I'm firing that quad. My knee is locked out straight. I don't want any pain in the front of the knee. I do want to feel that quad muscle firing, okay? Now, one thing that's important to note while I'm doing this shift of my body weight, some people tend to just shift their hips, and the momentum of their hips makes that band stretch and the knee straighten, but then I'm not really firing the quad. So I have to stay up tall, and as I squeeze back and I shift my entire weight and my chest stays over at my hips over that back leg, don't let your chest come forward and just rock the hip out, okay? Shift the weight, squeeze that muscle, hold it for about 5 to 10 seconds, build up over time, do about 10 reps, and really build on the endurance and the ability to contract that muscle at end range.